For today's C, guys, we're talking smart technologies in medicine, which falls under um, healthy aging for me. So here we go with today's C for you. Smart technologies, especially AI, remote monitoring, and telehealth are shifting care from episodic clinic centered visits to continuous data driven patient journeys that improve early detection, personalized treatment, and streamlined care coordination. Overview of how smart tech reshapes the patient journey. Smart technologies enable continuous monitoring, early intervention, and smoother transitions across care settings. AI driven image and signal analysis algorithm arguments, remote diagnosis and triage in specialties such as dermatology and or ortho orthotics. Remote patient monitoring or RPM platforms collect longitudinal uh, physiological and behavioral data, which supports proactive care and reduces readmissions when integrated into workflows. Practical guide, decisions, and questions. Key considerations: clinical goals, triage versus chronic management, data types needed, clinician workflow, fit, patient digital literacy, and regulatory privacy constraints. Clarifying questions to ask stockholders: which outcomes matter most? Readmissions, time to diagnose, patient satisfaction. What EHRs and devices must interpret, who will act on alerts and when. Decision points: prioritize pilots in high impact cohorts, e.g., heart failure, COPD, choose validated devices, and define education protocols. Evidence and expert perspective. Recent reviews show AI can match expert accuracy in some telemedicine tasks. Dermatology, retinal screening, and that RPM programs can improve coordination when paired with workflow redesign. Architecture combining sensors, edge central, AI, and clinician dashboards maximize value while limiting false alarms. MDPI, risks, limitations, and mitigation steps. Algorithmic bias and limited generalizability. Validate models on diverse populations and monitor performance continuously. Interoperability and data scenarios or solos. Adopt standards. FHIR and invest in integration layers. Clinician burden and alert fatigue. Tune thresholds, route alerts to care teams, and embed decision support into workflow. Next steps you can take. Run a focused pilot for one condition, which measurable outcomes, e.g. 30-day readmissions. Select validated devices and an integration pattern that supports FHIR and clinician workflows. Define governance of data, privacy, model, monitoring, and escalation protocols. Smart health care is combining AI, robotics, and NLP to make telemedicine and remote patient monitoring more accurate, continuous, and scalable, improving early detection, automation, automating routines, tasks, and enabling richer virtual care while raising clear governance and integration challenges. Key considerations: clarifying questions and decision points. Considerations: target clinical use, triage chronic care, diagnostics, data source, wearables, imaging, EHR, clinician workflow, fit and equity, digital access. Clarifying questions. Which cautions will slow measurable benefit, will show measurable benefit in 90 days? What EHRs and devices must interpret? Who will own alert triage and escalation? Decision points. Prioritize validated models, devices, define thresholds, and escalation. Choose centralized versus edge interface for literacy and privacy. From wearables enabling earlier intervention and scalable screening. Robotics extends telemedicine and remote procedural capability and automates routine tasks in clinics and home settings, improving throughputs and safety. Some workflows. NLP powers symptom triage, automated documentation, and virtual assistants that reduce clinician administrative burden and improve patient navigation. Evidence, risks, and mitigation. Evidence, systematic review, and recent literature report AI can reach expert level accuracy in specific screenings, tasks that RPM paired with workflow redesign improves. Monitoring and access. Okay, folks, there you go. There's your shows for this afternoon. I will see you guys later for shows. For now, Gator Wellness, take care, folks.